Welcome to Pulse and Pressors, where critical care gets crystal clear. Stroke volume is the blood ejected per beat, defined by N diastolic volume minus N systolic volume. Unlike cardiac output or cardiac index, stroke volume isolates mechanical pump performance independent of heart rate. It reflects the real-time interplay of preload, afterload, and contractility. Because stroke volume responds almost instantly to physiologic shifts, it reveals early shock long before MAP, heart rate, or CVP begin to deteriorate. This is why stroke volume is the hidden king of resuscitation. The three classic determinants of stroke volume, preload, afterload, and contractility, form its core physiology. Layered onto this are heart-lung interactions. Positive pressure ventilation increases intrathoracic pressure, which decreases venous return and thus reduces left ventricular preload and stroke volume. The key principle behind stroke volume variation, SVV, and pulse pressure variation, PPV. Rhythm stability and diastolic filling time further modulate stroke volume, making it exquisitely sensitive to changes the clinician may not detect in other metrics. The Frank-Starling curve describes how the heart adjusts its stroke volume in response to changes in preload. As ventricular filling increases, sarcomere stretch enhances contractile force, allowing stroke volume to rise, but only up to a point. On the ascending limb, more preload means stronger contraction and better output. Once the ventricle reaches its optimal length, the curve plateaus, and further preload adds pressure without improving stroke volume, leading to congestion instead of forward flow. In shock, where a patient falls on this curve, determines whether fluids will meaningfully increase stroke volume or simply worsen venous overload. Echocardiography uses left ventricular outflow tract velocity time, integral times, left ventricular outflow tract area, or LVOTVTI times LVOT area, a physiologically grounded method ideal for dynamic assessments. Pulse contour analysis extracts SV from arterial waveform morphology, but becomes unreliable in vasoplegia, arrhythmias, or low-resistance states. Thermodilution derives stroke volume from cardiac output divided by heart rate and inherits all thermodilution limitations. Impella or ECMO devices provide algorithm-generated stroke volume estimates that require contextual interpretation. Each method shines in specific scenarios and misleads in others. A rise in stroke volume of 10 to 15% following a fluid challenge signals preload responsiveness, which is preemptively predicted by stroke volume variation, SVV, or pulse pressure variation, PPV, in mechanically ventilated patients. Stroke volume declines early in shock, well before MAP falls, making it a leading indicator of hemodynamic collapse. Stroke volume incorporates more physiology than heart rate, MAP, or CVP, and guides fluid therapy with precision, preventing the venous congestion and organ edema that come from over-resuscitation. Stroke volume reductions are not always signs of volume depletion or pump failure. Dynamic left ventricular outflow tract. Obstruction can severely drop stroke volume despite hypercontractile function. Fluids and inotropes worsen it. Tachycardia shortens diastole, limiting filling and decreasing stroke volume independent of true contractility. Valvular lesions distort forward flow measurement. RV failure reduces LV preload, lowering stroke volume despite normal LV performance. High PEEP reduces venous return and falsely lowers SV, even when the patient is fluid intolerant. Stroke volume must always be interpreted through the lens of the operating physiology. Stroke volume is the earliest and most sensitive hemodynamic marker of shock. It moves with every change in preload, afterload, and intrathoracic pressure, guiding fluids, pressors, and inotropes more accurately than MAP ever could. Mastering stroke volume is foundational to mastering resuscitation, the difference between reacting to instability and anticipating it. This is Pulse and Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.